You're listening to In Sickness, a podcast about caregiving with Allison Breininger and Justin Bima. Good morning, Allison.
Hey, Justin. How are you today?
I'm doing okay.
Yeah.
It's the sun's out. It really is feeling like spring. And just kind of doing okay.
All right.
Yeah.
I love that I think I've said this before, but that we've reached the age where we talk a lot about the weather.
Yeah. It's inevitable.
It is. I have a friend who Marco Polo's me, and every time she's like, it's Wednesday and the sun is shining. And she lives like 20 minutes from me. Okay. So it's not like, I necessarily need the weather report. But I think, there's something, but we've talked about this, like the weather for me for sure impacts me. And so I think it's good information, but it does crack me up a little bit that we've reached the age of like, how are you? Well, the weather is
right.
maybe it's like a avoidance mechanism.
Yeah, maybe.
Instead of talking about how we actually are, we talk about the weather instead.
Right.
It's like a safer topic.
Yeah. Huh.
Interesting.
Well, actually, I think I'm feeling okay. I know that the winter was rough for me, and I talked about that. But I think that, I don't know, things just feel a little bit more in control right now.
That sounds awesome.
There's not, I think it was last month that felt super busy. This month doesn't at this point yet feel like it feels like there's more space this month. And so I can just kind of like wind down a little bit, I guess, if that makes sense.
Yes, 100%.
And just kind of, take things a little slower. And so I'm looking forward to that.
Nice.
Mm-hmm.
I feel the opposite. So I'm a little like drooling a little bit at what you just said.
Oh, I'm sorry.
It's all right. It's all really good stuff. It's all really like, there's lots of exciting things happening with the negative space and with our daughter who's about to graduate.
Oh, yeah. Oh.
Give me a minute. Okay. Lots of exciting things. But exactly what you just said about like taking some space to I'm like, nope. Yeah. So I should probably give the update that what we decided about the trip, because I've talked about the trip on here, the graduation trip.
Yeah, right.
I think we've gone back and forth. I don't know if I've ever updated here.
Okay.
Did I?
I think you talked about you were going to do something locally-ish, maybe?
Right, was the last thing I said here. So what we decided to do, and who knows, because now we're all tired again and maybe we'll change our mind. But as of right now, our sort of compromise plan is that we're going to go to Montreal.
Oh, that's cool.
Because people have said it's like very European feeling, because she really wants the like cobblestone streets and the little like bakeries and cafes and, that kind of thing. And so, and there's a direct flight, which is huge. And it's only like a 2-hour flight. And so at this moment, that is our plan. And so we have the tickets booked and the Airbnb booked.
Okay.
And we have an Airbnb that's like very close to lots of things. And that was also cool and cozy so that if any of us need to just like stay there the whole time. So that's the plan for right now. So it feels like a good compromise.
Yeah.
I also can imagine potentially at some point us all just being like, we're tired. That seems like a lot. Because like right now is her spring break. And at one point we had talked about going to maybe we go to New Orleans for spring break. Right. And just yesterday she's like, that would be a lot. What were we thinking? Yeah. So anyway, that's the update on that.
Okay. Good.
So it's all good stuff that's coming up, but sometimes that can feel overwhelming to me. And so I'm trying to stay like in the present moment.
Yeah.
And to remember that they are good things and to know that I'm a human and that if I am, not able to like attend something or whatever, that's okay too.
That's okay.
And so doing all the self-talk to get through it all.
Good.
Yeah. But some super exciting news that you will appreciate.
Let's hear it.
Is that, so, I had this great therapist a couple of years ago and then she left to have a baby.
Right.
And then I've tried multiple people since. Unsuccessfully.
Right.
And then there's this other person I had heard about. And so I had just called her office last couple weeks ago and said like, when's her first availability? And they said December.
Oh, wow.
Yeah. Yeah. It's like, that's not helpful.
No.
I just said goodbye. So I texted the old therapist and said, hey, long shot, you're not by chance like back from having babies, are you? And she said, I just came back this month.
Oh my goodness.
And I was like, what? Do you have openings? And she said, I sure do.
Wow.
And so I've already seen her twice.
Oh, fantastic.
And it's so great. It's so great. Because go ahead.
you've already laid the groundwork with this person.
Yes.
It's not a new person that you have to to start fresh with. Like, that's
Yes.
huge.
Yes.
Yeah.
Although it was kind of funny to be like, what has happened in the last
Oh, yeah.
year and a half? And I was like, oh, you didn't know about this. Oh, girl, you didn't know about this. So, but I just know that like the vibe, the vibe is
Mhm.
huge,
Yes.
right? She's trained in EMDR, which
Okay.
we've talked about, which is like
Yeah.
so good for trauma.
Mhm.
And I know that I need that, and she's
Yep.
trained in that. She's trained in, I don't know if she's officially trained in it, but she's the one that introduced me to IFS, which is like the board,
Oh, yeah, yeah. Mhm.
internal family systems.
Yep.
I don't think that's the right something family systems.
Okay.
And so she is all about that. She
Mhm.
already knows us. A funny thing is that like right after when she left to go on maternity leave, she actually came to one of my negative space launch parties. I think
Oh,
because she
wow.
like wasn't going to be my therapist anymore.
Yeah, right.
So she actually got to meet like all my family members.
Oh, wow.
And so then that's awesome. So now
Yeah.
that when I'm like, well, then when my
Mhm.
husband or when my brother-in-law, she's like, she met them. So
Right.
that's kind of the dream.
Mhm.
So anyway, this has just led me to, I did a post about therapy
Yeah.
and one of our listeners said, I really hope you do a podcast and support group on this topic. So here we are.
Here
Let's
we're
talk
gonna do
about
it.
it.
Yeah.
Because I think the thing that I wrote about in my post is like, there's a lot of reasons that we as caregivers can benefit
Mhm.
from therapy.
Yep.
And there's a billion reasons why we might not seek it or we might not be able to access it.
Yeah.
And so it's this really hard disconnect.
Yeah.
And so, or we might find somebody and it's a bust, like
Mhm.
has happened to me so many times. So I know that you and I both have benefited from therapy. And I just thought,
Mhm. Let's talk
do
about
it.
it. Yeah.
Talk about it. Would you mind starting by like sort of like what's your experience like or your history with therapy? Are you
Yeah.
comfortable sharing that?
Yeah, for sure. So I think it was probably about 10 years ago I started with my first therapist. I was feeling very anxious.
Mm-hmm.
My anxiety was like crazy. And so I went to my doctor and was like hoping just to start with like some medication
Sure.
basically. And he wanted me to try therapy first before prescribing anything. And I was kind of like,
Mm.
but I found somebody, and fortunately, I think I messaged her, and wasn't taking any new clients until like, I don't know, 4 or 5 months or something. And so I
Mm.
waited,
Mm.
and started seeing her. It was a great fit.
Mm.
I
The
feel
first try for
right. I feel super fortunate, and I know that's a very unique experience
yeah.
to just have that right off the bat. And I don't know how much of that is it was the perfect fit, or how much I maybe didn't need the perfect person. Like
Mm.
that I would be I don't know.
Interesting. Yeah.
Yeah,
Yeah.
that there's a little, could be both, some of both
Sure.
there. So I saw her for a number of years, and it was good because I started, and we working through anxiety and all of that. But as that was happening, Sarah was getting sicker. And
Oh,
so like I already had that lined up.
in
Like it
person or
wasn't
in place.
something
Mm-hmm.
that I had to try to seek out amongst all of this other stuff. Because I think it would have been harder had it not
Mm-hmm.
already been part of my
Sure.
life
Sure.
to try to carve out space for this new thing.
Mm-hmm.
And so that was really helpful. And then she stopped practicing and referred me to someone else who was a good fit,
Wow.
who I saw up until maybe a little over a year ago. And then she was no longer going to practice, and I got referred to someone else, and that's been a good fit.
Wow.
So I feel like I'm very unique, and
Yes.
in that experience, I recognize that that's not how most people have experienced it, where
Yeah.
it, like yourself, have had, experiences where things just did not click.
Right.
And so, yeah, that's kind of been how it's gone for me.
Mm-hmm.
I'm at a place now where I'm not having to do it as frequently as
Mm-hmm.
when I was in the thick of it, which feels good.
Mm-hmm.
But it's just been a really helpful tool for me to have a place where I can offload
Yeah.
what's going on in my life, having someone that is outside of it, that is a neutral
Mm-hmm.
party, that I can just dump things on. Like
Totally.
that's why they're there.
Yeah. Yeah.
Like I'm paying them for that.
Yeah.
So it's great. And just to help, whether it's tools to help me work through my anxiety, whether it's like processing all of the grief
Mm-hmm.
around this journey that Sarah and I have been on. Or, I've had some intense, stressful seasons with work and kind of helping me work through some of that. It's just been really good to have that as a tool and a space in my life to, have a place where it's about, okay, how is my life going? What can we do to improve my situation? Or just feel validated with what I'm going through.
Totally. Well, and even when you just said to have a place where it's all about your life, right? Like so much of our lives are around our person.
Mm-hmm.
And when we have a therapist, it's like, it's about us.
Right.
Like that hour gets to be a focus on us. And when else in our lives is there 55 minutes or whatever that gets to be, that's about us?
Yeah.
Like never really. Right.
Yeah.
And where the person is dedicated to us because, I'm trying to like change the health system so that doctors and whatever start to see caregivers.
Right.
And, I'm potentially hopeful that that might happen. But at the end of the day, like their main person is always going to be the patient.
For sure. Yeah.
Whereas this therapist, like their main person is us.
Yeah.
And like, that's amazing. Right. Yeah. And I think just as I'm saying it out loud, I'm like, oh, like that's kind of a beautiful thing. And, I do one-on-one coaching with caregivers. And sometimes like I get to say that to them, like, okay, I get that this thing's happening to your person, but I'm your person.
Right.
You know what I mean? Like I'm always going to be like on your team first.
Yeah.
And so to have this person, this therapist who's like, how are you? And like really means it.
Right.
I think a lot of the things that you said too are so powerful about like it's objective, like it's neutral.
Right.
So you can go in there and say, a lot of times I think caregivers are afraid to say like, I feel really resentful about this.
Right.
I feel guilty. I feel angry. I'm worried about this thing. I am grieving about this thing. The thing that you're like, ooh, if I say that to my person, if I say that to my mother-in-law, if I say that to my friend, they might judge me. They might whatever. They're coming in it with their own lenses, right? This therapist is just like, boop, neutral. I mean, obviously no one's neutral, but it's supposed to be neutral. And we get to say all the things that we feel like we are worried to say or don't feel like we can say to other people. And that's huge. Like we need that release.
Yeah.
We need to be able to say that. Yeah. And I think the fact that like with a friend, let's say I go out to coffee with a friend and then they say, how are you? Like, I'm always a little worried. Like, do they mean it? Like, how much of this can I say before they start to like melt a little bit, or like their eyes get big or I traumatize them or am I going to scare them away? And with a therapist, like, it's not supposed to happen. It can't happen still, but it's not supposed to happen. And like, they got to come back next week, no matter how, no matter how much we dumped on them.
Right.
Which doesn't always happen with family and friends.
Yeah. Well, I think too, you talk to whether it's family or friends and people don't always know how to respond. They don't respond well. Like if you are seeing a therapist, they are literally trained in how to have those conversations with you, how to not just listen, but help you like work through or work towards a solution or like what is the underlying stuff going on in yourself that we can unpack and maybe get you in a place where things can feel or look a little different, even whether that's externally or just within yourself.
Absolutely.
Yeah.
Because I think, I'm a huge proponent that like, I think we all need, like we all could benefit from therapy. And we all just went through this giant traumatic pandemic that like nobody's really processed.
Right.
We're just like, oh, remember when that happened? Oh, okay, let's just move on. So I think that like there's a lot of things that all of us could benefit from.
Right.
And we know as caregivers that our mental health is more at risk.
Yep.
So these are scary numbers, but 90% of caregivers experience anxiety daily.
It checks out, I think.
Right?
Yeah.
So, we just know that, of course we do. Of course, our mental health is more at risk because we are going through a lot and we are holding a lot. And so it's important for us to build up this toolkit and to have people. And so, of course, we're making it sound all like shiny and like, well, let's do it. And let's talk about like, what are the reasons that a caregiver might be hesitant to even look for a therapist?
Yeah, for sure. I mean, there are logistical challenges.
Yeah.
There is, how do I find someone I'm comfortable talking to?
Mm-hmm.
How do I don't have the time or energy to put into that project
Mm-hmm.
as someone who feels spent. There
Mm-hmm.
is, there's the cost aspect, which,
Mm-hmm.
therapy is not inexpensive typically.
Not inexpensive, right?
And, while some may be covered by insurance, it's like, okay, I have to find somebody who's within my network
Mm-hmm.
and working through all of that. And you find somebody, but like, oh, they don't work with your insurance. And it's just, I think we do so much medical stuff
Yeah,
with insurance and all of that, dealing with our person, that to take on more of that for ourselves just
totally.
feels like I don't have the space to go there.
Mm-hmm. Even I think the appointment itself.
Yeah.
At one point I saw, I'm just remembering this as we're talking, that there was somebody who was like a health psychologist who practiced at Sean's clinic.
Okay.
And at first I was like, this is great because she's a health psychologist, so she gets this stuff.
Mm-hmm.
But then my appointment was in his clinic and like in like an exam room, essentially.
Oh,
And I was like, talk about re-traumatization. Like,
yeah,
what?
that's not ideal.
Like, you are great. But you would think it would be like, oh, this is so convenient.
Mm-hmm.
I could drop him off and then I could whatever. No, like I need you to be in a totally separate space. Like I don't, you know what I mean? And so I think that, and whether it's that or even just a regular appointment, sometimes just like the appointment fatigue that we can have. And, you and I just both talked about like sometimes when there are things on the calendar,
Yeah.
right? It can be like, ugh.
Mm-hmm.
So even if it's something lovely or helpful, it can feel like, oh, another appointment.
Right.
On top of the financial piece.
Right. As well as even like, do I have the time?
Yeah.
Like you may not, your life can be so full, so busy. Like where can I carve out that hour?
Yes.
Maybe plus driving to and from an appointment. Right. Like where does that fit?
Yep.
And am I going to have to find someone to be with my person while I'm doing that and coordinating another thing? It just, it can feel like too much and just like I can't.
Yeah. Well, even if you do it virtually and you're in your house and your person's in your house, right? Like I often think, like I'm like, our house is not that big, and sometimes I'm like, where is the corner of my house in which I can hide? And then sometimes I like turn the dehumidifier on next to me as my like noise machine,
Yeah.
But so even if you are in your house, like that can be tricky because your person's right there, and so then you're like whispering, like, okay, so then this happened,
right? Yeah.
But I think that caregivers, many of us are like not good at doing something that's good for us.
Yes.
Because our plates are full and our time is spent and all of that. And so to, like you said, to carve out an hour or like an hour and a half or 2 hours if we have to travel for something that's like for us, already we're bad at that.
Yeah.
Whereas we would never be like, oh, you need an appointment. Oh, do we have the time? I don't know. But because it's for us and our well-being, we're quick. Sometimes caregivers can be, I shouldn't generalize, but can be quick to say like, nope, I don't have time. I don't have time for that. And it's one of these, and I'm sort of preaching to myself here as well. It's one of these where it's like, okay, you think you don't have that hour, but the benefit of that hour is going to mean that later hours are going to be better.
Yeah.
Right. And so it's like, if I don't have time for that, we also don't have time to like start having panic attacks.
Right.
You also don't have time to have be trying to deal with these big emotions on your own. Right. And so if we can preemptively be in there doing that, I think that's huge. And I think that, there's this author, Lori Gottlieb, that wrote a book about therapy. I think it's called something like You Should Talk to Somebody. You read that, didn't you?
I started reading it.
Okay.
You Should Talk to Someone, I think it's
something
called.
Like that. Yeah.
And I didn't finish it, and I can't remember. Something about it felt, I don't know, because it talked about, I think, like what therapists take on, I think, as part of that, maybe.
Interesting. Yeah.
And it just felt like too much of like behind the curtain that I didn't want to like know about the whole thing. I don't remember exactly what it was, but it was just like, I'm okay not knowing all of this. And like, I already know that like therapy is beneficial for me, so I don't need a book to reinforce that. But I think I've heard good things about that book. Yeah.
Well, and essentially my takeaway was that she talks a lot about is like, it's sort of like dating,
Okay.
right?
Yeah.
I mean, I think you are super rare, Justin, in that you have found
Yes.
3 people on the first try was a great fit.
Yeah.
And so that it's like dating. And then if you try one, like you shouldn't just, first of all, stay with them if it's a bad fit.
Right.
And then secondly, you shouldn't also give up.
Mm-hmm.
And so I think that can feel really hard because, again, we don't have the time and the energy to like try again and then schedule and then like, oh, and so this is my story and then see how it goes. Right.
Right.
And that's what I've gone through.
Yeah.
Is that over the years, I've tried lots of different people. And I had someone like a long time ago that I saw regularly, but she got to a point where I felt like she almost, it was like she was like excited for me to come in because she wanted to see like what happened on this week's episode of Allison's Soap Opera Life, which is true. I mean, it is like a soap opera, but it was almost like she's like sitting there with her popcorn, like, tell me what happened. And I'm like, you know. So there's that piece. And then just other people, like it just has not been a good fit. And I think also because our time and energy are precious, it's like, okay, you don't have to waste your time with that, but also don't give up. You know, like it is a sort of a dating game. And so are there things that you can, yeah.
Well, I can imagine it feeling awkward. Like you have, you set up an appointment and it's not a good fit. And then it's like, do I just ghost them? Do I have to write them and say this wasn't a good fit? But also like they're professionals and I would hope understand that you have to look around to find a good fit and that they would be hopefully super understanding of that. But I think it plays into some of our social anxieties and things like that as far as how to manage that.
Right. Well, the funny thing is, as caregivers, I wonder if that comes into play. Like even you saying about reading the book, that you were starting to be like, oh no, I don't want to worry about my therapist's feelings and like how this is impacting her, you know? And so, and I've heard that from a lot of people that like that therapists, there have been therapists who are like, oh, you're a caregiver. Let me tell you about my person.
Oh boy, that's...
Or like, oh, somebody said recently that they're like, oh, you're a nurse. Let me talk to you about, like, it's like when therapists see that the person they're working with is like, emotionally like adept at some of these things. Ends up like sharing their story. I'm like, friends, that's not the point.
No, that's not good.
Not the point. No. So, I mean, just like in any profession, right? There's people who are skilled and people who are less skilled or more effective or less effective. People who are effective, it isn't like dating, right? And so someone who could be a perfect fit for that person might not be a perfect fit for you. And so I think that's a bummer is that like, when I was thinking about, okay, what are the benefits of therapy? One of them is like, that person's not going to brightside you, except maybe they will.
Right.
They're not supposed to, except maybe they will. They're not supposed to be scared off, except maybe they will. Right? Like there might still be therapists that you tell your story to and it's gory and it's terrible. And then they like, pass out a little bit.
Yeah.
Right. So they're not supposed to, but they're humans. And so that still might happen.
Right.
I think the thing I hear the most from folks who decide to come and, chat with me is they're like, I have a therapist, but they don't get it. And so I think that that's a tricky thing is that, as caregiver, if you haven't lived the caregiver life,
right,
there's a certain part of it you can't get. And that doesn't mean you can't be helpful in a lot of ways.
Right.
But there is something to finding a therapist or someone to talk to who gets it.
Yeah.
Because there's kind of nothing like it. And that's what I love about like even our support groups is like someone will say something that they out loud on the Zoom that they, that when they say that in any other room, everyone like passes out a little bit. But on the Zoom, everyone just starts nodding and they're like, yep. Yeah. Right. Because, and I think that's so validating, right, for us to have that. And so that's tricky. And I wish that there was some sort of like caregiver training or something that therapists could have that we could be like, oh, these people are specifically trained to be good at that, Yeah,
I was looking, I'm sure there are other directories available, but the one I am most familiar with is Psychology Today.
Yeah.
PsychologyToday.com is where, I've always seen to go there to look for a therapist. They've got, and it's actually not just the US, it's other countries as well.
Cool.
So that's great. But I was looking, they have like criteria for like, I'm looking for someone specifically to deal with these things. And I was hoping that caregiving would be one of those things.
That'd be nice.
But it wasn't. And
shocking.
That's too bad.
I wonder, was chronic illness or...
Chronic illness was.
Okay.
Yeah. So I think that there can be well, that maybe is more geared towards someone who is dealing with that. They would probably be someone who's more adept at some of that kind of stuff. So there's some things you can help with there. I think another thing though that feels like a barrier is like, one, what is this process? What does therapy look like? And there's all of these acronyms for different types of therapies.
Yeah.
And what do all of those mean? And which one do I want?
Sure.
So this therapist is good at cognitive behavioral therapy, but is that what I want to work on? Or this person is, you mentioned EMDR. Is that what I need?
Right.
And that's, I don't know, that can feel like you have to learn about some of this stuff before you kind of get into it.
Right.
And that's unfortunate. And for me, I just kind of like knew I wanted someone to talk to. And I don't know that I've done anything formal with any of the acronyms or anything like that. I don't know. Maybe they have been, and
they're probably doing it. You don't know.
Yeah, and that's fine, I guess. But if you do want more knowledge about the process and the types of therapies or anything, I'll put a link in the show notes. There's on Psychology Today. There's a really good series of articles on like getting started with therapy, finding a therapist, types of therapy, and all of that stuff that can help kind of demystify maybe some of the process. And maybe it would be helpful there.
Yeah.
And then I think another piece is just the fear of opening up.
Yeah.
For some people, talking about your feelings can be really hard. And feeling like I have to talk for an hour. Like, what am I going to say for an hour? And I think I had some of those reservations going in too. Like that wasn't like a strong suit of mine. And I'm glad that I went for it because I'm sure those first couple sessions were kind of awkward and like me not saying as much as I should be. I don't know, like not talking and expressing everything, like just not being as open as I've become. And I think that is kind of in and of itself is a learned thing for a lot of people. And, I think that like even being able to share here on this podcast and talking about my own experiences and things like that, I think that the years of therapy and having that sort of, I don't know if training's the right word, but exposure to just having some of those more in-depth conversations has benefited me in that way as well.
Absolutely.
Yeah.
Well, think about it. How often in our lives does anyone say, how you doing?
Right. And really mean it.
And mean it.
Yeah. And not just, what's the weather? That's fun.
Well, it's rainy here today.
Yeah.
That's how I am. Right. And so how often do they ask? And how often when they ask, do they want more than a 3-word answer?
Yeah.
So we are just not trained as humans, or especially as caregivers, to talk about ourselves.
Yeah.
And to talk about how we're doing, or to even think about how we're doing. And so it's this kind of foreign concept to be like, I get 55 minutes or whatever to be about me.
Yeah.
Because even, it's funny, like when I do coaching sessions, people are like, I feel so weird because I feel like I want to be asking you how you are. And I'm like, I mean, you can, but the thing is that like, it's different than if you and I went out for coffee. And in a friendship, a good friendship banter is sort of like, I talk for how are you? You talk, how are you? Like we go back and forth and it's like 50-50. And if you get to the end of the coffee date and I'm like, wow, Justin just talked the whole time about himself and never asked how I was, right? Like that's not how friendship is supposed to go. But in these spaces, that's exactly how it's supposed to go.
Right. Yeah.
And it can feel really weird because that's not how our social norms have taught us to be.
Right.
To either like really talk about how we're feeling or to not share the airspace.
Yeah.
And so it can take a little while to get used to that because it's not something we've been able to practice or access. But it's important.
For sure.
So important.
Yeah.
And I think something that's helpful for me is to know that like an appointment's coming up. So like, let's say this afternoon, something really hard happens.
Yeah.
I can sort of like put it in a little pocket and be like, okay, on Thursday, I'm going to get to talk to her. Yeah. And I'm going to get to pull this back out of the pocket and we can talk about it then. And it feels like there's a time and a space that is dedicated to open that back up and talk about it, as opposed to just sort of floating.
Or I'm going to put that in a pocket and just not
ever.
Right. Like I think the difference between like shoving it aside and shoving it aside for the moment, knowing that you're going to get to it on Thursday and really work through that. I think that's a big
Big difference.
Big difference. Yeah.
Well, and a word that my therapist used the other day that I really have been loving is metabolize. Like we need to like metabolize. Like we talk about like processing our feelings, but I really like that metabolizing it, because it just feels like, okay, it's gonna come into you, or like the thing came into you. And like if you think about it as like, okay, I'm gonna eat a
banana.
Thank you. And like there's pieces of that my body needs, right? And so I'm going to take some of that in, and I'm going to keep some of it, and I'm going to use some of it for this and some of it for this. And then there's others that's going to be waste, and it's going to come out. And but it needs to be metabolized. And I think that's such a cool word to think about in that way, because otherwise, I don't know how this analogy is going to play out with like a pile of bananas. I don't know, that rot and start smelling. I don't know. But you know what I mean? If we don't start metabolizing the things, it doesn't work. But I think something that's so true about us as caregivers, for sure humans, but definitely us caregivers, is that the stuff keeps happening.
Right.
The stuff keeps happening to us. And so it's almost like I said to somebody the other day, it's like brushing your teeth while eating Oreos. Right?
Yeah.
And you have to do it. You have to keep trying to brush your teeth, because if you don't, your whole mouth is just going to get full of Oreos. But it's not like someone who like ate an Oreo a long time ago and now gets to brush their teeth. Like the Oreos keep coming. And I think that's such a hard thing, because we're just like trying to just climb out of the hole, and we're trying to like process the things, metabolize the things, but more things keep happening.
Yeah.
And that's what's been so tricky for me in therapy over the years, is that like, we're like, okay, next time we'll get to this. But between this time and next time, 17 new things happen.
Yeah.
And so I think that makes it even more important that we have a space to even, I guess I'm all about the analogies, but we talk about like burp in the Tupperware. You know, like you put it all in the Tupperware. Do you know what that means? Like, like burp. And so again, like we put it away for a while, but we need some space to like, or like release the valve or whatever, however you want to say it. So to have a time and space to be able to just like at least skim the top off or something as the hits keep coming.
Right.
Because otherwise, I mean, otherwise it comes out sideways, and it might come out sideways anyway, because there's a lot, but at least then you've got more, you've worked through some of it,
Yeah. So we've talked through some of these barriers for therapy. So what can people do to kind of overcome those? And not that we're trying to, not like say, counter anything you have, like, well, no, I can't do it because of this. Like, well, you could try this. And like, we understand that for some people, it's going to be a really challenging thing to do. And maybe is truly not accessible. And so, while there are some things that can help, it's still hard. And I just want to say that. And I know that both of us are very fortunate to be in a place where we can make it a regular part of our life. And that we have that privilege, and not all people have that.
True.
So there is, there's individual therapy, and then there's also group therapy, which can be less expensive. And it's going to depend on what is available for you in that regard. But from what I understand, that's like, I think like grief is a really common type of group therapy, where you have multiple people, a therapist working with the group, and everyone is sharing their experience through that, and you're kind of all working to it together. And I think a really powerful part of that is like, you are with people who are going through what you are going through. And I don't know, it seems like that would be a place where having like caregiver group therapy could be hugely beneficial, but I don't know that that's a thing, that how much that exists. But that is an option. There's also a lot of therapists have sliding scales for cost. And so if you are not in a place where you can financially, pay their full price, that's maybe an area where there's some room to negotiate, or some work there that can be done. And then outside of that, I was doing some reading, and saw a recommendation for like, if there is a university near you that like has training for therapy, that there may be low cost or no cost options for the, students who are training in therapy and need that experience, and can help you as they're, going through their schooling. And so that could be something to look at as well. And then there are things that are, well, not substitutes for therapy, can also provide a space to help go through some of this. And their support groups can be helpful.
Mm-hmm.
Certain coaching can be helpful. And while those are not a substitute for, they can be places where you can get some of the benefits of therapy in that space.
Yeah, absolutely. And so I'll just say, we have a support group here that attached to this. So we'll have a support group about therapy coming up. It's a little meta, but
Yeah.
And I think you're right when you said the thing about the group and being with other people, that like, I know someone who just went through Grief Share is a national program. It's faith-based. So someone who just went through Grief Share, and even though that person didn't totally appreciate the facilitator, I think they appreciated the curriculum and they appreciated the people. And so it doesn't have to be quite as much of a perfect fit because there's all these other factors involved, if that makes sense.
That does.
So I think that's something about a group situation. So, we have support groups that attach to these topics, and those are totally free and open to anybody. And I'll just say that like it's on Zoom, you can come, you can have your camera off and you can just listen and not, or if 5 minutes in, you're like, not my jam, off you go. No problem. No hard feelings. I offer one-on-one coaching. I have a sliding scale that goes down to $0. Again, I think that it's a good complement to therapy. Certainly I do not diagnose or medicate or anything like that. But again, it's more of a space with someone who gets it. Right. And so that's an option. I know that there are some places that, like here in town, we have Jack's Caregiver Coalition. And they have what's called Jack to Jack, which is like peer mentoring. So sort of similar to what I do, but it's more of just like find a person, they have people that they sort of train who have been caregivers in the past or are current caregivers who are like, hey, you want to go out for a beer and talk. So sometimes that kind of thing is available. Again, I think those are a little bit different. Like those are good, like release the valve spaces, but it's different when you have like an expert, hopefully, who is able to say like, what might be going on in your brain right now, or what might be, you know what I mean? So I think that all of these things are like, how many of these tools can we put in our toolkit? I think another thing I would say is just like the piece about like micro moments that we talk about. So if there's kind of a whole continuum, right? Micro moments are not going to, picking at your coffee mug is not going to replace therapy, right? No. And there's tiny things that we can do. Like what are those micro moments that we can do throughout our day? You and I were actually talking this morning about, I'm not going to do it into the microphone, but kind of when you like blow through your lips, like a horse, maybe I will do it like that, right? And how like that's actually really helpful and therapeutic and good for your nervous system. And so, I mean, there's like little tools like that, or like I use the Calm app a lot for a lot of different things. Tools like that we can have to have like little micro moments. And then we can have sort of the middle guys that are sort of like therapy, medication, support groups, coaching. And then I also want to just mention that, there are times that we might be in a situation that feels really unhealthy and that we feel like, we're not able to get out of bed, or we're not able to meet our basic needs or our person's basic needs. And like, so NAMI, I think it's the National Association for Mental, I don't know what the I stands for. But like they have all kinds of hotlines and you can call or chat at any point. And they've got people always kind of standing by so that you can, talk to somebody if you need that. And there's no shame in any of that. And that all of us are just like in a really intensely hard situation. I think something we haven't talked about yet today is there's a really also high incidence of PTSD in caregivers. I just saw, because it's Head and Neck Cancer Awareness Month, that caregivers of people who have head and neck cancer have the same occurrence of PTSD as the patients. So there's just a lot going on, and there's just a lot of reasons that so I think this is what it comes down to. We deserve and need support. And I think that we might stop ourselves from realizing and acknowledging that. And we might say, wait, I don't have time. I don't have funds. I don't have access. I don't have, the space that, it's selfish. It's blah, 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 blah. Right. And it's true that some of those things might be absolutely like maybe you're in a town or a space or an insurance situation where that's not the case. But if the thing that's stopping you is like, well, I don't deserve it because I need to spend this time or energy on my person, I want you to know that you need and deserve support.
Right.
And so to dig into like, what are some of those ways? And if either of us, I mean, you and I are not experts, but either of us can help support you in thinking, brainstorming, like, what could that look like for you?
Right.
I think that we would both be really helpful or happy to do that.
Yeah.
I think something else quick is that just about medication.
Yeah. Okay.
So I know you said at the very beginning, you were hoping your doctor would give you medication. You said you have to go to therapy first. And I get that he was like, I'm not just trying to medicate people. Like, I want the balance. And sometimes we need the medication to be able to even access the tools that the therapy is going to give us.
Yeah. Right.
Right. And so I just want to say that I am pro medication and when needed as well. And so I want to just say that, like, there's, we do not need to have stigma around that either. And that, like, whatever, we need a variety of tools in our toolkits to get through this hard thing called caregiving.
Yeah, for sure. A couple other things that I just want to bring up is, one, as far as access goes, I mean, you alluded to, having therapy online, the telehealth stuff, all of that came out of the pandemic.
Yes.
Like, that has been very beneficial. Like, I haven't gone in person to see a therapist since, I guess, early 2020.
Yeah.
And that's been great. It means it's less time away from work, because for me, that's where I took the time from. I wasn't taking it was hard to take the time away from me caring for Sarah and our time together. So I take it from work.
Yeah.
And so being able to just, on a day I'm working from home, step away, do that for an hour and come back, use an hour of sick time, that works out really well for me.
Nice.
But you mentioned also how, depending on your living situation, that can feel really stressful to be talking about all of this, and feels like, not that they're going to be listening, but that someone could just inadvertently overhear what's going on.
Yeah.
So I don't know, maybe you can go out and do it in your car or something.
Right. Totally.
Something like that could work. So there's that piece. The other thing that I thought of is, depending on if you do have a job, and depending on the size of your company, they may have something that's known as, I think, an employee assistant program.
Exactly. Yes.
Which I know for the company I work for, it's kind of like, you have your health insurance, and then this is kind of like a thing that has a variety of other services. And often one of those services is a limited number of sessions with a therapist or counselor or something like that. And so if there's a very acute moment, or you're just like, I need someone to talk to, that can be something, and it's free, by the way. That can be something to take advantage of. And, it's not a long-term solution, but maybe it's part of helping you find a more permanent way to manage, or find someone to talk to more regularly. So I think that's a good thing.
I'm so glad you
look
brought
into.
that up.
To see if that's something you can take advantage of.
For sure. Yeah. So they're called EAPs, employee assistance programs.
Yes.
And I think you're right. Even when you said earlier, like, I don't know, do I need like CBT, cognitive behavior? Like, what kind of therapy do I need?
Right.
What do I like? If you can do these couple free sessions with someone, then they can maybe by the end say, you know what I think might be beneficial for you?
Yeah. Right.
This and this and this. Here's where you could look, So start there. And I think that employers are getting much better about really wanting to help their employees, so that, because obviously they know, like, if you're not well in any way, you're not going to be a good employee. Right. And so they're really, a lot of them are trying to build up things like this. And so instead of maybe being like, oh, I don't want my employer to know that I need therapy, to be like, hey, what do got? Check in with HR, check in with your benefits to see, because they, want to sort of preemptively have you be healthy so that you can do your job, But I love your idea about like taking a sick hour or whatever.
Yeah.
I think one thing that's tricky is that sometimes when we open up that Pandora's box of feelings, then I think it can be tricky to just be like, slam it shut, go to the next meeting.
Yes. So maybe you could, if you can have that at the end of your day, for sure. And that's, sometimes driving is a buffer for that. If you, back in the day when I was going to appointments, having that 15-minute kind of switch gears kind of thing can be helpful too. Yeah.
So real quick, supporters. What can our supporters do to help?
Yeah. I think one thing we haven't talked a lot about is they're still can be this stigma
Yeah.
around mental health, around therapy, around, you mentioned medications, all of that, that somehow like there is this notion that we should still be able to like manage this all ourselves and we shouldn't need this external help. And as supporters, don't feed into that.
Yep.
Let them know that that stuff is okay. Don't maybe push it on them, but being open, if you're talking to someone who's a caregiver, be open about if you're someone who has had mental health struggles or has seen or is seeing a therapist, share that with them that like, I've been doing this. This has been really helpful for me. It might be something for you to think about. Or, if I can help you find some candidates, like if you can, as a supporter, and I think that this is one of those things where you have to have the right relationship with the person, but maybe they express that they want to, see a therapist, but they don't know where to start or who to find. Maybe you can take some of that initial work of going through a directory, filtering by what you think, or what, you've communicated they kind of are specifically looking for, and give them a short list of candidates.
Yeah.
Doing some legwork that would be hugely beneficial.
Amazing.
Yeah.
Yes. Totally amazing. I actually did that for someone who was like, I don't even know where to start. And so I just said, tell me a couple criteria.
Yeah.
And then I went through and then I found different profiles and who's available and like they're all 20 minutes within your house, all those things. And so, I mean, that would be huge for someone to offer to do. I think the other thing is to say like, I would love to, or be happy to come sit with your person.
Yeah.
Even if you're going to do telehealth, some people, while they're doing telehealth, like have to keep an eye or an ear open. Right. So I'm going to would be happy to sit with your person so that you can either go or you can do your online thing.
Yep.
Just to kind of like break down some of those barriers. I think the other thing, and I'm glad that you and I do this, is just like talking about therapy casually. You know what I mean?
Yeah.
Because that's going to break down that stigma and be like, a phrase that people have been using lately that I just appreciate so much is, of course. Like, of course you would benefit from therapy.
Yeah, right.
Think of all that you're going through. Of course you feel anxious about this thing because right. So it's sort of like, instead of like a really special kind of thing, it's like, no, friends, of course we could use extra support. Of course we need someone to take care of us.
Yeah.
Of course we need an hour to process what we have gone through. Of course we do.
Yeah.
Because this is a lot. Like we're going through a lot. And so of course this, is something that we can look into. Right.
Yep.
I'm not saying that means it's easy.
Right.
But I'm saying at least for some of those like mental barriers that we might be putting up for ourselves, that might help us say like, we need and deserve support.
Right.
Yeah. Good. I'm so grateful that you and I both have good people.
Yeah.
And like I said, if there are ways that either of us can be supportive of people who are listening, we're not experts, but we are happy to do what we can to support and to cheer you on, even if it's like, you just want to send us a message to be like, I found one, or I made an appointment, like we will cheer with you for that. So just let us know, because we want to support you as well. Yeah. And if anybody's interested in learning about coaching or support groups with me, just reach out and let me know.
Sounds good.
All right, my friend, you have a good week, and I'll talk to you soon.
All right. Sounds good.
Okay, bye.
Bye.
You've been listening to In Sickness. Find us online at insickness.care or on Instagram at insicknesspodcast. You can send your questions and comments to insicknesspodcast@gmail.com. If you enjoyed the show, please share it with a friend or fellow caregiver, or leave us a review on Apple Podcasts. Thanks for listening, and take care.